Welcome to this poster presentation on Impacting Oral Health to Prevent Hospital-Acquired Pneumonia Through Nursing Knowledge and Leadership Development. This is being presented by Joan McCann, MSN-RN, and Genesis Medical Center in partnership with Delta Dental of Iowa. I currently work as a Nursing Performance Excellence Supervisor and have over 40 years of nursing experience, including many years as a nurse leader. This poster explores our hospital's quest to improve oral care and decrease non-ventilator hospital-acquired pneumonia, or NVHAP, rates in hospitalized patients. NVHAP is associated with increased mortality, increased length of stay, increased risk for sepsis, and increased costs. Research has shown introduction of an oral care program may be an effective method to reduce NVHAP incidence, morbidity, mortality, hospital length of stay, and costs. Oral care compliance improvement typically results in a 35 to 50% reduction in NVHAPs, which translates to lives saved and insignificant cost avoidance. Could be up to $40,000 per incident. Organizational leaders' knowledge and support can help ensure quality of care and better outcomes. Positive outcomes can be expected when leaders strategically plan to use innovation and learning to facilitate changes within an organization. The purpose of this evidence-based practice project was to increase nursing staff and organizational leadership knowledge on NVHAP, preventative measures, and to implement oral care guidelines. During the root cause analysis, we found patients lacking appropriate oral care supplies and a substantial knowledge deficit regarding the importance of appropriate oral care among the nursing staff and organizational leaders. The interventions decided on would be a system-wide practice change and included purchasing of oral care kits consisting of an ADA-approved toothbrush, sodium bicarbonate toothpaste, alcohol-free antiseptic oral rinse, and a non-petroleum-based moisturizer for the independent patients. To maintain compliance and adherence, nursing leadership conducted monthly rounding of patients' rooms to ensure access to the oral care supplies. Data regarding adherence to oral care interventions were collected through observational rounding to ensure compliance and access to the oral care kits. Process changes and implementation strategies included the following. We conducted a pre-assessment survey on NVHAP knowledge and oral care perception. We provided NVHAP education to nursing staff and organizational leaders. We provided in-person oral care competency education to all nursing staff. We created a Facebook page for learning and a messaging place. We designed pictographs. We sent the pictographs via technology for visual learning of oral care process and practice change. We performed a post-assessment survey on NVHAP knowledge and of leaders and staff. The evidence-based practice project was considered a success based on the following, and you can refer to Figure 1. Patients' utilization of oral care products increased during the first quarter of 2020. Data regarding oral care perceptions of the post-intervention survey showed a greater than 30% improvement in knowledge of NVHAP and appropriate oral care. NVHAP rates decreased by 30% during 2020. The fall of 2020, during the peak of COVID, NVHAP rates were a record high, and the organization was challenged to step up training efforts. Now, in 2021, the rates are at a record low, and compliance with oral cares have improved drastically. Leaders and staff made this happen. Through all the innovative, long-term efforts of our hospital, we were able to improve oral care and ultimately prevent NVHAP and save lives in our hospital patients.